So hello friends, so in this video I'm going to discuss what are the hormones increased in women's life during pregnancy. So the first basically the hormonal changes in women during pregnancy, and second that is what is hemodilution and what are the importance of hemodilution, and fourth that is what is hypervolemic state and how this hypervolemic state occurs, and next what is physiological anemia in pregnancy and what are the causes of the physiological anemia in pregnancy. So all these points I'm going to discuss in details in today's video. So friends, so the following hormones increase in women's life during pregnancy. The first one is the estrogen, second one is the progesterone, third one is the oxytocin, and the fourth one is the human chorionic gonadotropin. And the increase in the level of all these hormones in women's body, so here that is leads to hormonal changes in a women's body during pregnancy. So these are all the description of hormonal changes during pregnancy. So now I'm going to explain that is what is hemodilution. Now, so before knowing hemodilution, so see this diagram. So by seeing this diagram, so you can realize the components of blood. So the components of blood are blood plasma and the blood cells. And blood cells are red blood cells, RBC, white blood cells, WBC, and platelets. So all these, so here substances they together contribute to the blood components. Now before knowing hemodilution, so here you should know that dilution of blood is more when the amount or the level of blood plasma is high. Please remember that the dilution of blood is more when the level of blood plasma is high. First thing, and second that is blood is more concentrated, or the concentration of blood is more when the level of the blood cells is high. So this is the basic informations. Now that during pregnancy both blood plasma and the level of blood cells, especially RBC, increases, but the increase in blood plasma is about 30 to 50%, whereas the increase in blood cells, especially RBC, that is or the blood cells, is about, so here that is 20 to 30%. So therefore that is the increase of blood plasma is more than the increase of blood cells. So during pregnancy, that in the blood the level of blood plasma is more as compared to a level of the blood cells. So due to more blood plasma in the blood, so the dilution effect is more, and that increase of more blood plasma, so during pregnancy in the women's blood is known as hemodilution. So friends, so as you have already understood that the hemodilution occurs during pregnancy, and this hemodilution means the excessive increase of blood plasma with respect to the other blood components. So this is hemodilution. But now I'm going to explain that is why it is important. Now the first cause is then to supply nutrition to both mother and fetus during pregnancy first, and second that is to ensure the gaseous exchange between the mother and the fetus during pregnancy. And also by seeing this diagram, so you can realize or relate that is what are the gaseous exchange. So from mother's body, that is oxygen goes to the fetus body, whereas from fetus body, that is carbon dioxide goes to the mother's body. And that this gaseous exchange, that is which is done at the level of placenta, is also known as double force effect. Now, so the first that is to allow the a nutrient supply to both mother and the fetus, and second to allow gaseous exchange between the fetus and the mother, and the third is that to prevent or the excessive blood loss during delivery. As you already know that during the delivery of the baby, so here blood loss occurs, but that this excessive blood loss is also prevented due to more increase of blood plasma. So these are so about hemodilution. So see that the blood components are, or the blood is made up of, so here blood cells and blood cells under, so here RBC, WBC and platelets come, and also that is blood plasma. So blood cells and blood plasma together contribute to blood components. And also about a dilution of blood, what I have written, that dilution of blood is more when the amount of blood plasma is high, as the blood plasma has fluidity nature. Now see that, so here blood is more concentrated when the amount of blood cells is high. So this is the, so here that is concept about the blood concentration, and this is the concept about the blood dilution. Now here see that, so during pregnancy, so see that during pregnancy the blood plasma increases by 40 to 50%, whereas the RBC or WBC platelet mass together increase by about 30 to 35%. So see that the increase of blood plasma is more than the increase of the blood cells. So therefore that is the hemodilution occurs. So see that during pregnancy the amount of blood plasma, so here is more than the amount of blood plasma, as this increase of blood plasma is more than the increase of blood cells, and due to the more amount of blood plasma than the blood cells, that is hemodilution. So here dilution occurs during pregnancy. So this is the, that is region of the hemodilution. Now here again that is the importance of hemodilution, that is the first, that is to allow easy nutrient and gaseous exchange between the mother and the fetus. And also this is the main concept of double force effect, that is from mother to fetus oxygen gas is transferred, and from fetus to mother carbon dioxide gas is transferred. Second, that is to prevent excessive blood loss during delivery of the baby. So these are the, so here that is points of hemodilution. So now I am going to explain what is hypervolumic state. So friends, see this text written on the diagram. So by seeing the text you can realize that the blood volume range in the case of non-pregnant women, it is 4.5 to 5 liter. So this is the blood volume range of a non-pregnant woman. Now again see the text written on the diagram. So by seeing the text written on the diagram, so you can realize or relate that the blood volume increases by about 45% in the woman's life, so during pregnancy. And also you can realize that this increase in blood volume is too much, and that fast increase of blood volume in the woman's life during pregnancy, and this is known as hypervolumic state. So friends, so this is the RAS mechanism. So see that, so this is the angiotensinogen, so here it is produced by the liver and released by the liver. Now that this renin is a hormone, and this renin, so here produced by kidney, and this renin causes the conversion of angiotensinogen into angiotensin 1. Now again ACE, that is angiotensin converting enzyme, it is produced by the lung, and this ACE, so here that is causes the conversion of angiotensin 1 to angiotensin 2, and then this angiotensin 2, so here causes the retention of sodium and water, and due to the retention of the sodium and water, so here that is increase in blood volume and blood pressure occurs. So this is the main RAS mechanism. So simply just remember that renin, so here released by the pair of kidneys, and this renin causes increase in blood volume and blood pressure. That is, and how this increase in blood volume and blood pressure done? So this is done by the, so here retention of sodium and water. So this is the main concept of RAS mechanism. So friends, so as you have already understood the RAS mechanism, And simply just remember that in RAS mechanism, so here renin is released from the kidney, and this renin causes the retention of sodium and water, and this leads to increase in blood pressure and blood volume. So this is the main concept of RAS mechanism. Now, as you already know that in a pregnancy, the level of estrogen hormone increases too much, and this estrogen hormone so here stimulates the release of renin from the kidney. So due to more release of renin from the kidney, so here more sodium and water retention done, so as a result, so here blood pressure and blood volume so here increase too much in pregnancy. But one thing that you should know, that in pregnancy, yes, both blood pressure and blood volume increase, but the increase in blood pressure is not too much as compared to increase in blood volume. Now why? Now you should also know that in case of pregnancy, so here progesterone hormone also released, or the level of this progesterone hormone also increases, and this progesterone hormone so here that this causes vasodilation, and this causes vasodilation by causing relaxation of smooth muscles of blood vessels. So due to vasodilation, the blood flow through the blood vessel is very easy, so therefore no resistance, so therefore blood pressure doesn't increase too much, or this decreases the blood pressure. So the increase of blood pressure by the estrogen hormone is nullified by the action of vasodilation by the progesterone hormone. So the final conclusion is that during pregnancy, due to action of estrogen, the blood volume increases too much, and that too much increase in blood volume so here leads to a state known as hypervolemic state. So in this way, so here that is hypervolemic state occurs. So once again I am going to repeat. So due to the action of estrogen on RAS mechanism, so here that is both blood pressure and blood volume increase, but due to the action of progesterone on blood vessel, blood pressure decreases, and this decrease in blood pressure nullifies or neutralizes the increase in blood pressure by the estrogen hormone. And finally, due to action of estrogen, only the blood volume increases too much, and then this too much increase in blood volume so here is known as, so here that is hypervolemic state. So now, so here about the function estrogen on RAS mechanism. So that is estrogen stimulates the renin production from kidney. So as a result, there is sodium and water retention done due to the action of renin. And due to the retention of sodium and water, so that is blood volume and blood pressure increase. So this is the function of estrogen on RAS mechanism. Now here again, so here that is function of progesterone on blood pressure. So see that this, so here progesterone causes relaxation of smooth muscles of blood vessels. So due to this relaxation of smooth muscles of blood vessels, so here widening of blood vessel done. So this is the vasodilation. So due to vasodilation, so here that is the blood flow is increased, and the blood flow is done smoothly and clearly. So therefore that is the blood pressure BP is reduced. So this is the main reason why that is progesterone decreases blood pressure. So see there, so here that due to the vasodilation effect of progesterone on blood vessel, the blood pressure does not increase too much, or the blood pressure remains same. Now here, and due to action of estrogen on RAS mechanism, the blood volume increases too much due to the water retention, and this leads to hypervolemic state. So this is the main definition of hypervolemic state that I want to mention. And see, so this is the blood volume range in non-pregnant women. It is 4.5 to 5 liter, and this is the blood volume range in pregnant women. It is 6 to 6.5 liter. So now I am going to explain what is physiological anemia during pregnancy. So friends, as you already know that during pregnancy the level of blood volume increases, and also the level of blood cells, especially RBC, increases. First thing, and you also know that this level of increase of blood volume or the increase of blood volume is more than the increase of RBC. So the increase of RBC does not match with the increase of blood volume. So there is relative decrease of RBC or hemoglobin with respect to blood plasma, and then this relative decrease of RBC or hemoglobin so here leads to hemodilutional effect, and then this hemodilutional effect so here leads to decrease in hemoglobin or RBC level, and then this condition is known as that is physiological anemia during pregnancy. So once again I am going to tell. So during pregnancy, so the blood volume and blood plasma that during pregnancy blood volume and RBC both increase, but the relative increase of RBC is less than that of blood volume. So as a result, that is hemodilutional effect occurs, and due to this hemodilutional effect, that is RBC and hemoglobin concentration is slightly reduced, and this condition leads to a case known as a physiological anemia during pregnancy. That is. So now I am going to explain what are the causes of physiological anemia in pregnancy. The first cause is that increase of blood volume. As you already know that this increase of blood volume is more than the increase of blood cell. So therefore that due to this relative more increase of blood volume with respect to blood cell, so there is dilution effect, and this dilution effect leads to decrease in hemoglobin and RBC level. So as a result, there is physiological anemia caused. First thing. Second, that is the hormone level. As you already know that during pregnancy the level of estrogen increases, and you also know that this estrogen hormone so here inhibits or decreases the RBC production. So as a result, so here anemia occurs. Now the third thing, as you already know that for development of fetus iron is required, and all this iron required for fetus development so here that is provided or given by the mother's body. So in this way that is the iron stored in the mother's body so here starts to decrease during pregnancy. So as a result, that is the iron requirement in the mother's body also increases during pregnancy. Now as the stored iron level decreases in the mother's body during pregnancy, the RBC production is affected. As for erythropoiesis or for the formation of RBC, that is iron is required, but as you already know that in mother's body during pregnancy less iron is stored, so therefore less iron is stored, that means less iron provided for RBC production, so therefore that is the RBC production is affected or the RBC count is reduced. So as a result, there is physiological anemia occurs during pregnancy. So here about the physiological anemia in pregnancy. So the definition. So during pregnancy, the blood volume or the blood plasma increases and the blood cells increase. But the increase in blood cells, so here does not match with the increase in blood plasma, as the increase of blood plasma is more than the increase of blood cells. So this leads to a dilutional effect, that is the hemodilution effect, and this dilution effect causes a drop in hemoglobin and RBC with relative to blood plasma, and this condition is known as physiological anemia in pregnancy. So this is the definition of the physiological anemia in pregnancy. The causes, so here that is first increased blood volume, and also know that this increased blood volume that is leads to dilutional effect. See that this relative increase in blood volume that is leads to a dilutional effect, and due to this dilutional effect, so here that is hemoglobin and RBC level drop, so therefore physiological anemia occurs during pregnancy. Now the next step are the hormonal changes. As I mentioned that during pregnancy the level of estrogen hormone increases, and this estrogen hormone So here that is inhibits RBC production or decreases RBC production. Now third, that is increased iron demand. So during pregnancy, all the iron required for fetus growth are provided by the body of mother. So the stored iron in the mother's body decreases. So the required amount of iron needed for the RBC production in mother's body is not available as the stored iron is less. So therefore RBC production is affected and the RBC production is reduced, and as a result that is physiological anemia occurs during pregnancy.